your question was, how did I find out? I believe that's how I found out. And I thought, well, why not me?
You had mentioned earlier that you didn't consider that a strong decision, more of an intelligent one.
Yes.
Did you feel that you had all the appropriate information or access to the appropriate information, or was this intelligent decision, is it retroactively realized as intelligent?
That's a good question. There's no, I mean, I am sitting here today and I cannot say that I have all the information. Oh, for goodness sake, I'm a baby in this. I mean, I'm in kindergarten.
We all are.
There's no way that I have, and I never thought that I had all the information. I am a person who has been trained to make decisions. And I find it easy to make decisions. And I have the advantage of being a person who is attuned to their instincts, as well as a person who I'm learning every day. And I like to learn, and I read 2 newspapers a day and watch the TV news most of the day. And so it's gathering new information all the time, sorting it through, and then I'm willing to take a chance.
Did it feel like you were taking a chance?
Well, it was as much of a chance as anything else. I didn't know that it would work.
Mm-hmm.
But then I know the last medicine I took, Lyrica, and they certainly have a lot of newspaper TV ads for that drug. But taking that drug was a chance.
Yeah.
I mean, I've taken, I can't even name all the others, but as from my perspective, taking each one of those was a chance. Because it was putting something in my body and no one really knew what that drug was doing.
Once you had made that decision, was the process of getting the medicine and having it become part of your treatment, was it different than past decisions you had made about medicines or treatments?
I'm not sure I fully understand. I'm hearing more questions. Number one, finding a place where I could obtain medical marijuana from people that I felt I had good reason to be confident of them. That process was not easy. And I can tell you about how that process went. The other problem I have is simply getting to your shop, because I am so immobile. I must rely on the help of my caregivers to obtain that marijuana. So that was a separate problem for me. Does that answer your question?
Mm-hmm.
And to give kind of a preset too, to understand Natalie's position more of how she's able to treat herself now is that she's homebound. And so the dependence on someone else being able to get those products from us and get them home with the same dosing instructions has required that Natalie and I talk a lot. It has required input from me working with her caregivers. It's been a lot of communication that that I'm sure has to be frustrating on Natalie's part at times. That there's so many different people that she has to kind of jump with about this. But
Lydia, my whole life, my professional life, and some of the non-professional life has centered on communication. And my communication skills have been important to me. And I think I have good communication skills.
And I feel like
my real challenge right now in my communications is that I am working with people for whom English is not their first language. And they're very good English speakers, and they're very devoted to helping me. But that does challenge my ability to communicate.
Do you feel like that communication that you've had with us has been essential to finding the right way of using this medicine for you?
Absolutely.
Okay.
I have no way, I would not know about tincture. I would have no way of knowing about what goes into sativa or indica. I have no way. Absolutely, I'm 100% reliant on you to provide me with the alternatives of the different, for me I call it a recipe for marijuana.
I like that.
Well, I'm assuming that it appears to me that there is more than one recipe. There is no way that I could have any information, and I am relying on you to provide it for me.
I feel like with cannabis in itself, utilizing it has been even learning for us. We learn with you as these products work for you in a positive way, or we find that symptoms change. We know how to better develop those products. So I feel like there's a symbiosis between the patient, the product, and us, that none of us would really be here being able to do what we're doing without each other. So talking about how those products, when we started treating you back in July, we played around with a couple different products. At first it was mostly just capsules that you were taking, and we found that the cost affordability for it was pretty high, being able to afford. When we finally were able to examine your dosing of cannabis to find out what a therapeutic range meant for you, and as you had talked about, the electrical pain, like being shocked, had now came to a type of sensation that was maybe bothersome or there, but not necessarily painful. So on average, you're taking about 250 milligrams of cannabinoid content in a day.
250.
Yeah, you're
Is
taking
that a lot?
Well, depending upon condition, yes, that would be quite a bit for some people to take.
250 what?
250 milligrams of
Oh,
cannabinoid
milligrams.
content. Because we're giving you kind of a different blend, we have a sativa during your daytime in tincture form, followed up with indica capsules at night. We're going to start doing some research with you about how a topical works and how a different type of tincture works for different types of pain. So when I look at the cost affordability, your first month with us, you spent over $335 just to kind of get set up to find what worked for you. Once we were able to establish a real clear dosing schedule for you that seemed to be helping, we were then upwards of $652 in a month. So obviously when we think about that and think about the affordability of most patients, being able to spend that much money per month on their medicine, that's a
Well,
great statement.
Well, I had told you $600 a month is too much.
Right. You know, the next month, as we started tapering off the capsules and into a new product, we were, you know, jumping right around that $500 range. So to give you some math of what the types of milligrams that you're taking and the cost of that, you know, you're roughly in 30 days taking in 75 grams of cannabis in its raw form. But of course, we concentrate it down so that the delivery method is easy, less invasive to you, and that you can absorb the whole cannabinoid profile, which has worked thus far for certain issues. When you have to talk to people about using this medicine, we've talked about cost. Obviously, that's a conversation you have to have with your caregivers, possibly with family members. How do those types of conversations go? Do you feel like people are understanding to?
Well, the first group of people that I could mention is I'm in a Bible study group, and there are 4 women who come here and they're in my room here once a week, and we all have a special program that we're working on. Each week we have, this month we're working on 1 and 2 Peter in the New Testament. These women are very understanding about the fact that I have had pain, and are very accepting of my decision to use cannabis. And as the weeks and months go by, they have been fascinated by how it all works. And every week they want to know. So there are 4 people who apply, 4 people who have accepted it very positively. With regard to my family, the only person who counts is my son. My son is a physician. He specializes in pediatric intensive care. And his response, or his inner feeling when I first told him that I was going to be using cannabis, his response was he did not think that it would work. So he has been with me through the years, and he has watched all of these medicines not working.
Right.
And
hard not to get discouraged at that point.
he didn't. And he has been, well, fascinated would be too strong a word for my son. He has been
clinical curiosity.
Clinical curiosity, yeah. And that I don't know what that is. All the people who are helping me, the people all in the house here are all Filipinos, and they themselves have no experience with cannabis.
Right.
And frankly, I have no idea what their
Thoughts.
background or thoughts might be, but they're very accepting of what, if I want to do it, they're very accepting. And they're fascinated to see.
Have you found any misunderstandings that maybe people have about your use? I mean, I find some patients, they'll talk to their family about using cannabis, and the first thing that people will talk about often is like the idea that they're smoking it, which obviously is not a way that you're using cannabis as a treatment. But that's a common misconception that people have, is thinking the only way you can use cannabis is to smoke it. So I was just wondering if you've ran into any maybe common misunderstandings that people might have about you using it.
Well, I can say that the women in the Bible study group had no understanding about different ways of using it.
Right.
And for myself, I would never have thought about a tincture. That was new to me.
Right.
And for my son Lincoln, I asked him about it, and he just smiled, and I asked him why it worked, and he gave me a medical reason why it worked. So,
But he was able to kind of substantiate that for himself and for you. Well, that's good. We like that.
Do you think he is in a position where, as a medical professional, he can talk openly and honestly about his thoughts on cannabis?
oh yes.
Yeah.
Like Lincoln, my son's name is Lincoln. He is, how do you put it, his mother's son. He's very verbal. No child of mine could grow up without being verbal.
Or passive, I have a feeling.
So I have 2 Native American children that I adopted, and Lincoln was born to me. But even the Native American children are remarkably verbal. So anyway, there's more information than you were asking. Lincoln would be able to do it. The person that I most have it on my list of things to do, all the stickies or things to do, or idea. I get an idea in my head, and I don't want to forget it. And I
should ask
haven't-
Matt about my sticky notes.
Right, have him write a sticky. One of those stickies is for me to write a letter to my pain doctor. Because my last meeting with the pain doctor was that we had agreed that there was nothing else that he could prescribe except for a patch that would go on my back perhaps, and from that patch would be released 24/7 of a measured amount of opiate.
Right, fentanyl probably, or morphine. Yeah.
My thought was it was morphine, but I don't know. It was just an opiate. And the wanted to try medical marijuana before I tried those tattoos. And I didn't really ask his permission, but if that was okay by him, then that's what I would do. I've not gone back to him for the prescription of the patch. Obviously, I don't need the patch, but my point is, of all people who ought to know about what cannabis can do for someone in pain, a pain doctor ought to know.
Do you feel like the stigma surrounding cannabis prevents people from being able to openly talk like that with their doctors a lot of times?
I can't answer that question.
Okay. Because I mean, for you,
I mean,
it's a
it's
very
not-
clear decision. You're
it's
like,
not-
oh, I've got to tell my doctor about this, but I know.
It's not from, that does not apply to me. I told you my attitude about the legality of all of this is, and I am not saying this as a joke. I'm saying they're welcome to come and arrest me. I dare them. Wouldn't that make what
The media
what
mess
a
that would make.
Oh, that would be a teaching moment.
That's a good word for it, a teaching moment. That's nice.
No, those aren't my words, so that's a common, that little two-word phrase is, you hear politicians talk about that.
The teaching moment. I'll have to
The
look that up
teaching,
now.
the teaching moment. Yeah, well, that is what it would be. And from my perspective, the person who would be in a very good position to be helpful would be someone like a pain doctor.
Right.
Someone who is in the establishment, who has paid his dues, and who is able to understand enough about cannabis that he could accommodate that information in what he's doing and could actually begin to recommend it. Now I can say, to back up, I can say that, also say this. In order to purchase any cannabis from the beginning, I needed an authorization.
Right.
And I had two physicians at that time, a neurologist and my primary care provider. And the two of them were almost in competition with one another as to who would give me the authorization first. I mean, they were both very eager for me to try the medical marijuana. So, and
Gotta
those
start sending people to these doctors.
are
No.
two very different people.
Right.
So those are two other, so what I know, 4 physicians, my son, the pain doctor, neurologist, and primary care. So I've not felt ever that I had to be quiet or not speak out as to the fact that I was using.
Right.
And if someone can't deal with it, that's too bad.
I think that's encouraging to hear, because you know we see people who you know the process, they're not as confident in themselves in making these decisions, so it's really good to be able to see and feel your confidence in your decision.
And
Well,
to know that there's
but-
support
but-
out there like that, that's not.
But remember, remember, we're talking about real pain. I mean, a person can put up with a lot if they can find relief from pain. Well, I am not lacking in confidence.
No.
That's